So your doctor, after taking the history, which includes family history of prostate cancer, especially in your dad, before the age of 60, your doctor would also examine your prostate. The prostate is a smooth, walnut-sized gland that lies between the penis and the bladder. And your doctor would usually use his gloved finger to go into your rectum to examine the prostate. And that is to feel if the prostate is small or enlarged, regular or irregular, is it smooth? And then based on this, your doctor would want to send you for a prostate scan to check is this an enlarged prostate gland, as well as doing a blood test called the PSA test, which is the prostate-specific antigen. And this is a protein that is naturally produced from the prostate gland. If the PSA is raised above the normal value for your age, your doctor might want to recheck the test in a few weeks. And this is because you might have a falsely raised PSA due to other reasons such as strenuous exercise, vigorous sexual activities, cycling, as when you sit on a saddle, it stimulates the release of the PSA from the prostate gland, especially if all this takes place within a 48-hour period, or if you have an enlarged prostate, you've had a recent urinary tract infection or prostatitis. However, if your doctor strongly suspects that based on the symptoms, history and examination, that this sounds like prostate cancer, because you could still have a normal PSA with prostate cancer, or if your PSA blood test came back as super high, whether in its thousands or higher than it should be for your age, then you really need to have further tests done, such as an MRI of your prostate and a prostate biopsy. Now, an MRI is more detailed and accurate than having an ultrasound of the prostate, and a prostate biopsy would usually involve using a thin, long needle to collect samples of tissue from the prostate gland, which are then analyzed in a lab looking for cancerous cells. Now, in terms of treatment, this depends on the type of prostate cancer, as you have slow-growing prostate cancer and you've got fast aggressive prostate cancer. With the slow-growing prostate cancer, treatment is not usually necessary and you're usually monitored regularly, along with having 3 to 6 monthly PSA blood tests. And if the PSA tests are rising, then your urologist would usually consider if treatment is needed. Now, fast aggressive prostate cancers need treatment, as it's more likely to spread to other parts of your body, such as your bones. So if you're someone who's getting rib pains, back pains, chest pains for no obvious reason, then your doctor should be doing a PSA test, especially if you're over the age of 40. Now, I hope you enjoyed this video and share this to all men that need to know more about the prostate and the importance of doing checks for the prostate to make sure that they're not at risk of having prostate cancer.